Have you ever noticed yellow bumps or spots on or around your eyelids? Many people have seen these yellow patches, but have no idea why they are there, or if they pose any threat to their health. But one thing is certain, you should not ignore this, as it may be a sign of an underlying serious health problem that you could be having. Let's see what are these yellow patches, why they appear, and how can you get rid of them. Xanthelasma is basically a skin condition in which fat, lipids, or cholesterol starts depositing under the skin. There is a certain type of cells under our skin, known as macrophages. Basically, these cells belong to our immune system, and they have the capability to engulf foreign toxic particles or germs to save our body from developing an infection. So when macrophages encounter lipid particles or cholesterol, they capture them, and the fat particles get stuck under our skin, particularly under the eyelids. These lipids or cholesterol keep accumulating there gradually until they show up in the form of flat yellow spots and sometimes yellow bumps on the eyelids. And these are what doctors call xanthomas, and the underlying medical condition is known as xanthelasma. Now let's see what causes them. Number 1. Unhealthy diet. Since these yellow patches are usually a result of fat deposits under the skin, it means that you may have too much LDL or bad cholesterol in your body. One of the most common sources of this bad cholesterol is diet. Red meat or processed meat, such as hot dogs, hamburgers, pork chops, and sausages, are typical sources of unhealthy saturated fats and bad cholesterol. Consuming a lot of high-fat dairy products, such as cream, butter, and whole milk, can also increase LDL or bad cholesterol in your body. Other potential sources of unhealthy fats are fried foods, French fries, cakes, pastries, donuts, sweets, and foods cooked in low-quality vegetable oils. But it's not just diet that can increase your cholesterol levels. Before we proceed, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, then please support us by becoming a patron. Number 2. Poor digestive health. Having high cholesterol levels in the body can also be simply because your body may not be able to digest fats properly. This can happen due to a number of reasons, such as poor digestive health, inflammatory bowel disease, and even bad liver health. Number 3. Liver dysfunction. Especially liver plays an important role in regulating cholesterol levels in the body. The liver produces bile juice, which our body uses to digest fats and lipids in food. So if the liver is not producing enough bile, then our body may not be able to metabolize fats effectively. Also, certain liver conditions, such as liver cirrhosis, fibrosis, non-alcoholic fatty liver disease, and hepatitis C, are also linked with high cholesterol levels in the body. Number 4. Poor thyroid function. Hypothyroidism is a condition in which the thyroid gland does not produce enough thyroid hormones, which can lead to a slowdown in metabolic processes in the body, including cholesterol metabolism. Studies have shown that people with hypothyroidism are more likely to have high LDL cholesterol levels and are at an increased risk of developing cardiovascular disease. Number 5. Some other possible causes of high LDL or bad cholesterol are high body mass index, particularly above 30, weight gain, or obesity. Plus, unhealthy lifestyles such as staying inactive quite often, excessive smoking or alcohol consumption can also wreak havoc on your body, including your immune system, gut, and liver. Lastly, certain medications, type 2 diabetes, and genetics can also be the reasons behind high LDL or bad cholesterol. Xanthelasma often shows up to be completely harmless and without any additional symptoms. However, having high LDL or bad cholesterol can also be a sign that you may have a high risk of developing high blood pressure, hypertension, heart disease, and even strokes, although it's not always true. According to studies, around 50% of patients suffering from xanthelasma already had heart disease or had a high risk of developing heart disease and associated risks. That's why experts say that you should never take it easy and get yourself checked whenever you see xanthelasma or yellow spots on your eyelids. Now let's see how can you get rid of them. First, as already said, It's crucially important to get yourself checked with a skin specialist to properly diagnose and find the root cause behind xanthelasma. In many cases, this skin condition can be easily treated with the help of certain medications. In worse cases, these yellow spots can also be removed via surgery. Cryotherapy is another effective way of treatment in which the affected parts are exposed to extreme cold. That makes it easier to remove these fat deposits from the skin. Some home remedies to help treat xanthelasma make use of garlic or onion juice, but it's not a scientifically proven way of treatment. However, several studies have shown that eating garlic on a regular basis can greatly help you reduce bad cholesterol levels in the body and reduce your risk of developing skin conditions like xanthelasma. Thank you for watching and subscribing to the channel. See you in the next video.